Lyme disease seems to be on the rise again. And I'm here to make the case as to why I think this is happening and the challenge that is being faced with regards to Pfizer and their new vaccine. You'll be glad to know that they are at least looking at a vaccine for it. But if there's anything that we've learned from the COVID pandemic, is that it is not straightforward to resolve this kind of problem. And so, what I'll show you first is what is happening with regards to Pfizer's recent work on this vaccine. And it just shows you that at the moment, we are in a situation where you can plan to be able to get resolution for this kind of problem, but there is no guarantee that what you're trying is necessarily going to work. So here is what Pfizer has announced just recently in March. And when they looked at their Lyme disease vaccine candidates, they found that it showed strong efficacy in phase 3, 70, more than 70% in terms of individuals who are over 5 years old. However, I think that they've been having a problem with regards to recruitment, but so far they think that 73.2% efficacy compared to placebo, but this is after 4 doses. And this is part of the reason why I think many companies are interested in this, is because of this system associated with subscriptions. But I'll let you understand that principle in just a second. Here first is the overview with regards to Lyme disease. So here we have a condition that is primarily caused by a tick bite, and it's a Borrelia bacteria. And what happens is that people who are usually out in the woods get bitten by this particular tick, a deer tick. And these ticks live in grassy areas. So, and it usually, if you take off the ticks early, you can reduce the chance of infection. However, once it has bitten, you can then get this bullseye rash called erythema migrans. Then people can feel a bit sick, and in some cases, it can go on to be quite significant with disseminated symptoms, including damage to the heart, the muscles, and neurology. And long term, as I said, people can struggle with this. And one of the things that is happening is that some people who are, they perceive have chronic symptoms related to COVID are probably just a degree of reactivation of Lyme disease. And I'm going to explain that as well as to why I think that is happening. When it comes to diagnosis, it's the symptoms. There's some antibiotics that are effective in the early stages, but a lot of people never fully recover. And this is one of the problems that we're facing, is that a lot of people have this problem. And I'm going to explain why I think that they are having reactivation and potentially what we can do about it. Here are all the things that can happen, from neurological, cardiac, musculoskeletal, and just general fatigue, very similar to long COVID. And just some simple principles is that if you are out in the woods, avoid the tall grass, wear long sleeves, check your body as well as your pets, and shower soon after being outdoors. And not everybody who gets a bite ends up with Lyme disease. So it's important to understand that pattern with regards to the general overview as to what is going on. Now, in order to understand what they're trying to do with regards to the vaccine and why some people end up with chronic symptoms, here are some other important facts that should help you to grasp why this condition is so challenging. So, this particular bacteria, remember it's a bacteria, not a virus, and it can evade the immune system, leading to chronic inflammation. And what it does is, firstly, it can change the surface measurements or markers so that it avoids the immune system. So it varies the antigen on the surface, kind of like what a virus can do. So it looks different. It changes its jacket, puts on a new hat so that the immune system doesn't easily recognize it. Additionally, it can evade one of the important immune strategies the body has, which is to label these bacteria with complement. And so what it does is that it puts them on its surface so that the immune system can't use complement to target it. Beautiful. Then, on top of that, it will find other ways to suppress the immune system locally. And when it does that, it then gets stuck in what we call extracellular matrix, where you have collagen and around joints, and it then gets hidden there so that you can't get control. And guess what happens is that the immune system sometimes will then allow it to go dormant. Stops growing, it stays dormant, the immune system can't target it, it's hidden away. And so this is the strategy that this particular bacteria uses. And the question is if this is happening, why does it get reactivated? And what is the connection with regards to COVID? So, this is the bit that is very important. A lot of people don't understand that essentially with COVID, it's like spraying petrol on the embers of a fire. So, this Borrelia, if somebody has chronic inflammation related to it, that has settled, what then happens is COVID can reactivate it. All right. Because remember, at this point, it can remain hidden and they have no symptoms, but sometimes they have just mild symptoms, a little bit of joint pain here and there, a little bit of fatigue, some neurological symptoms, some cognitive issues. But then when it flares up, all of this gets so much worse. And this is the critical thing, is because it has developed multiple immune strategies, it is the immune system, when it gets reactivated, that leads to inflammation in the presence of the bacteria. Really important differentiation, because it's not the bacteria that is doing damage, it is the immune system that is doing this damage. So let's just run through how it works again. What you have is that this Borrelia evades the immune system. It's then stuck in the body tissues. The immune system stays activated, but sometimes it's controlled inflammation. Then you have the chronic damage that occurs over time. And what we've been seeing since COVID is that some people are having flare ups. And the question is, what is the connection? This is what I'm trying to explain to you. And it will then help you to understand what the target is with regards to the vaccine. Before I tell you, well, actually, let me tell you why I think that this is happening with regards to COVID. This is now a very important point that helps you to understand how I look at the post COVID inflammatory processes. So essentially, what happens is that imagine that you have a person who has Lyme disease. The Borrelia is persistent in the tissues. So here is the bacteria sitting there. The immune system has got it under control. It can't replicate because the immune cells are right there. You have these two cells and the CD helper cell that coordinates the inflammation, and these regulatory cells that tell these cells, listen, don't overdo it because you will damage the tissue. So this is critical. These regulatory cells keep the inflammation in check. Guess what happens? When you then have an infection, it disrupts this. So the function of the CD4 helper cells are impaired, as well as it depletes these regulatory cells. So suddenly now, this stable environment gets disrupted and you end up with low levels of these regulatory cells. Then you have immune cells coming in because suddenly now you're having cytokines being produced, because it's almost as if the body goes, wait, we've got to do something about this. This is then what causes the inflammation to start up again. And this is really important. And a lot of people don't understand. They think to themselves, I was okay. I didn't have any issues. And then suddenly I had a little infection. And then now all my system is going haywire. And this is the point, is that if you lose the immune balance, and this is the point here, first you have the balance. Remember, the inflammation is there, but it's stable. then it gets disrupted by the virus. Once that happens, this is the inflammatory reactivation. This is the spraying the petrol on the inflammatory process. And this is what people don't get. You have to therefore address the inflammation in order to resolve the problem.
In truth, this video isn't really about Lyme disease. It's about the immune dysregulation that can occur in relation to Lyme disease. And this is the bit that I'm focused on and trying to see if I can understand. Why are so many people struggling at the moment with symptoms? And this is something that I think we have to try and see if we can find answers for. The challenge is now that we need to have a better understanding of immune dysregulation and how this process can become worse after a COVID infection. If you want to learn more about that, please just click on the link in the description and we'll learn and go on this journey together.